Good afternoon. Joining us on the line now is Dr. Olha Vorodyukhina and Jean Bertram to talk about what we should be taking into account if we decide the time is right for a little nip and tuck. Dr. Olha is part of a third generation of medics. Her talent in medical aesthetics has made her one of the top experts in the field. Jean works closely with Dr. Olha to make their clients' transformations the best experiences it can possibly be. Together, they've written a book. It's called Beyond the Mirror. Welcome to the show, ladies.
Hello, good afternoon.
Hi.
Hello, hi, Anna.
Hello, thank you both so much for joining us. So, Dr. Olha, to start with you, how did you get into this field? It's obviously in the family, is it?
Medicine definitely goes back into my family, but facial aesthetic is something that I discovered through my career, and I always was interested in beautiful things and how we can look better and feel better. So I think this choice fitted perfectly with my personality.
It's interesting, isn't it? Because years ago, people used to talk about cosmetic procedures, facelifts and things like that as something that celebrities would do or wealthy people would do. But now there are so many more different products, if you like, that are a lot more accessible to the everyday person.
Absolutely. The industry has evolved dramatically, and I think you have a choice how little or how far you want to go in order to feel and look great. Our book is reflecting not on celebrities or rich people, it's just on all ordinary people who make those choices and what impact it has on their life.
And there's so many procedures now that don't involve having an operation, don't involve going under the knife.
100%, and a lot of non-surgical procedures in some way overtake surgery because it's predictable. When it's in the right hands, I would say it's safe. And I think what is important, it has very little downtime. And I think patients stay in control. They are awake, they know what's going on. And very often it's a discussion and a journey between patient and practitioner when patients participate in what's happening.
So, Jean, when people come to you then, when you have a new client who makes contact and says, okay, I want some help. I want you to make me look younger. I want my skin to be tighter. They have all these demands. I guess a lot of the time, if they've never been before, if they've never had anything done, then they'd also have lots of questions.
Yeah, absolutely. Lots of questions. And because we work so closely together and I have treatments myself with Dr. Olha and have had for years before I actually came to work with her, then it's quite easy for me to reassure. You can look at my pictures, you can see me on YouTube, and again, it shows that we can make these changes very naturally without looking like the celebrities that people think that they would scare them if they were going to look like that, the things that we see on television. So the book is very much around how it makes people feel and not to be scared when they're thinking about taking that step.
Yeah, there must be a certain amount of worry with some women, not with everybody, and not just women, of course. Because it's the unknown, isn't it? And of course, we see it does happen. There are horror stories of treatments that have gone wrong, either to do with Botox, things like that, or obviously more famously, maybe, boob jobs, infamous, all the things that have gone wrong there over the years. So I think some people can be a bit nervous about having these sort of treatments.
But the negatives are quite often followed by the media more than the positives. So
sure.
If you worked it out percentage-wise of complications that we get, it wouldn't even hit a 1% of what we do. So again, the book explains that, how to look at what's true and what's not true.
But one thing I would like to highlight here, I think patients need to be cautious when they make the choice. Because, most definitely shouldn't be taking this decision lightly. Most definitely you need to choose the right clinic and safe, experienced practitioner, because unfortunately in countries like UK, where our clinics are, aesthetic medicine not regulated, so potentially anyone who has no background in medicine can just purchase the product and start performing the treatment, and this makes it extremely dangerous. And I think that is where negative impact on the industry coming from. But when it is in the safe hands, the relative rate of complications are quite low.
Yeah, that's a really good point to make. I was going to ask you about that. What sort of questions should potential clients or patients be asking the practitioner in order to ensure that they're in safe hands?
I could give you the list of questions. It's really endless. And I would say to the patient and customers, please ask as many questions as you want or wish until you feel comfortable. I would say the first and the most important question that patients should ask is, who is their practitioner? And practitioners should have medical qualification. On top of that, what experience they have to perform certain treatments, how long they have been doing this for. The patient should ask what can happen, what they will do if things go wrong, what support is available in the clinic. I think we see a lot of patients in the clinic who comes from already have had treatments elsewhere, not necessarily complications, but they have had some experience. But most patients wouldn't know what product has been used. And I think it's very important to know what actually is injected in your face, if we talk about injectable treatments, or what skincare you apply on your face. I think sometimes it's bizarre that we would know which brand of clothes we wear, but don't know what actually we put in our bodies. I think definitely we need to ask those questions before making the decision, is it's right for you or not. And pay attention if the practitioner have checked your medical history, have they advised you on possible risks, because every treatment has risk and side effects. It could be very minimal, but still need to be taken into the account. And I think it's very useful to see some before and after images, because most clinics will have a portfolio that they are happy to share with their customers.
Okay. Good advice. And something else which I find really interesting is how people seem to be getting younger and younger having these treatments. I mean, I remember years ago it was something that an older person would have in order to try and look younger, whether it's a facelift or even Botox. But youngsters in their 30s and even in their 20s, you see like contestants going on Love Island talking about having Botox, and I'm thinking, why on earth are women in their 20s getting Botox? Why would they need Botox? Can you explain?
So there is no time frame as such, like we need to say, okay, you're 25 and you need to have Botox. I think it's all very individually prescribed, tailored to patient needs. I definitely welcome preventative treatments, and we see this trend in our clinic where younger generation of patients come and they want to do things before it will start to be noticeable or it start to get worse, or they see how their parents age and they want to prevent this problem. And I think they have all the right to do so. And with the right means, we're able to help them. I don't think we should say to the patient, go away and come back when your eye bags are prominent, when your jawline is saggy, and then we can have a conversation. I think it was quite upsetting. So, but what I think is wrong when people overdo or abuse this treatment, when they create disproportionate, unbalanced face, prominent cheekbones, lips, which is naturally has never been present there. So this type of look, probably some sort of trend, celebrity style, I don't think is wise or ethical. And that is something that we definitely advise against, because this treatment, although they non-surgical, they can result in permanent changes of soft tissue of the face and deformities, which we can see later on in life. So I think prevention within right means, and certainly treatment for skin, preventing the aging process, is the right thing to do. And I would advise to start looking after your skin and skin health in your early 20s. If you have a problem such as acne, rosacea, acne scarring, then we can start looking at this even earlier. So it all depends for what reasons we're doing this.
Sure. I didn't realize, to be honest, that you could get preventative treatments. That's really interesting. I just assumed that the treatments were to, change the look of the face or get rid of wrinkles or different things like that. And I sort of couldn't understand how and why 20-year-olds who presumably don't have wrinkles would be getting these treatments, but you can do preventative treatments. That's really interesting.
Yes, absolutely. And as I said, it's just depends on what we're trying to achieve. I think aesthetic medicine very quickly and confidently becoming a part of wellness industry, because when we look about how we age and how we look, everything in our body is connected. So when our customers come to the clinic, we give them all-round approach and holistic advice. So that is including on the lifestyle, diet, exercise, and coming to the treatments itself.
Another thing, a question I have is about how often people would generally come for these treatments, as in how often, how long they would last for, because I guess it's the kind of thing, I mean, again, please correct me if I'm wrong. If you, once you start having these kind of treatments and you like the new way that your face or your eyes or whatever looks, you're going to want to keep that look up, I assume. So how often would people be coming for these sorts of treatments?
Again, that is, each patient would have their individual treatment plan, which based on their needs, on their clinical presentation. And of course, we need to take in consideration the budget. But for example, if we would talk about treatments such as skin health treatment, chemical peels, facials, these treatments will require more often visits every 4 to 6 weeks. And that is related to the cycle of our skin cells turnover. When we talk about injectable treatments, the result is longer lasting. For example, Botox or anti-wrinkle injection, whichever we want to call it. The result can last between 3 to 6 months, and it varies from patient to patient. Their lifestyle, certain patients with high metabolic rate might require treatment sooner, when others have a longer lasting result. And treatments such as dermal fillers, again, it's individually based, but once we achieved the results that patient happy with, we put them in maintenance stage, where we just see patient every probably 4 to 6 months in clinic, and we're not necessarily completely start the treatment from scratch. We're working on that where we see that the area needs to be addressed at the time, and we treat this area at the appointment. And in this way, we allow patients to look better, and it's like a cumulative effect. So where we're starting reversing the signs of aging, and that is when you see that patient can look 10 years, 5 years younger than before.
And Jean, are you seeing an increase in men coming to the clinics as well over the years?
So definitely, and the gents that come are quite confident to come in. We make everybody feel really welcome. I don't know whether Dr. Ola has mentioned that we've won Best Customer Service in the UK in our clinic at the Safety and Beauty Awards in December.
Great.
So that's something we're very proud of, and everybody that comes through the door gets treated exactly the same and looked after in the same way.
Fantastic. That's really great to hear. Well, it's a really interesting subject, and I've really learned a lot today. So I'm sure many of our listeners have as well. Thank you. If people want to learn more, they can get a copy of the book, of course. It's called Beyond the Mirror, and it's available to buy on our website, tre.radio. It's by Dr. Olha and Jean Bertram, who we've been chatting with. Ladies, thank you for joining us.
Thank you very much.
Thank you very much, Hannah.